Listen carefully. What I'm about to share today could truly make a difference in saving your life. Every single time you use the bathroom, your body is sending you signals. It's trying to communicate something important. But most people simply flush and move on without giving it a second thought. They don't realize their body might be urgently trying to warn them. Ignoring those signals can be a serious and sometimes fatal mistake. It may sound unsettling, but I've witnessed this situation far too often. People dismiss the early warning signs because they assume everything they're experiencing is normal. Then, one day, they receive devastating news, a diagnosis like cancer, and by then, it's often too late to take effective action. Here's a reality that rarely gets discussed. Your stool acts like a health report for your body. It provides important clues about what's happening internally. The color can reveal issues related to your liver or pancreas, or even indicate internal bleeding. The shape can signal whether something is obstructing your intestines, including potentially serious conditions like a tumor. What's even more concerning is that some of the most dangerous signs can appear almost normal at first glance. You might take a quick look and assume everything is fine, while something life-threatening is quietly developing inside your body. That brief, slightly uncomfortable moment before you flush when you take a glance could actually be life-saving. Today, I'm going to guide you through exactly what you should be paying attention to. You'll learn which types of stool are the most concerning and when it's critical to seek immediate medical attention. But this isn't about creating fear. It's about giving you knowledge and control. I'll also share practical, realistic steps you can start applying right away to protect your health. These suggestions are simple and accessible. They can help whether you're already on medication, dealing with limited mobility, or managing a tight budget. And the final two insights I'll reveal are especially powerful. They have the potential to noticeably improve your health within just a few weeks. Before we go further, there's something essential you need to understand. Most people don't actually know what healthy stool looks like. It's not something we're taught. People avoid the topic because it feels uncomfortable or embarrassing, so it rarely gets discussed. But ignoring it because of that discomfort is a major mistake.
Let me break this down in the simplest way possible. Medical professionals often rely on something known as the Bristol stool chart. It's easy to find online. You can even print a copy and keep it in your bathroom for quick reference. A quick search will bring it up right away. This chart classifies stool into 7 different types, labeled from 1 to 7. Type 1 appears as small, hard lumps, similar to rabbit droppings. Type 7, on the other end, is entirely liquid, almost like water. What you should be aiming for is stool that is brown in color, soft in texture, and well-formed, something that resembles a smooth sausage-like shape. It shouldn't be overly hard or excessively loose, and it should pass easily without causing discomfort. When your stool looks like this, it's generally a sign that your digestive system is working the way it should. That brown color actually comes from bile, a substance your liver produces. Bile starts off as a greenish fluid, but as it travels through your digestive system, it gradually changes to brown. This shift in color is a positive sign that everything is functioning properly inside your body. In terms of frequency, having a bowel movement once a day or at least every other day is considered normal, ideally occurring around the same time each day. If you find yourself going much less frequently, or if there's a sudden and noticeable change in how often you go, that's your body signaling that something may not be right. Now, this is where things become more serious. Healthy stool should have a normal thickness, roughly the width of your thumb, maybe slightly wider. If you begin to notice that your stool is becoming unusually thin, like a pencil or a narrow ribbon, it could indicate that something is compressing or narrowing your intestines. That kind of pressure might be caused by a growth, and in some cases, that growth could be a tumor. This isn't meant to alarm you unnecessarily, but it's something many people simply aren't aware of. They notice thinner stool and assume it's just constipation, so they wait, hoping it will resolve on its own. Meanwhile, if the underlying cause is something more serious like cancer, it continues to develop with each passing day. If you observe pencil-thin stool more than twice within a single week, you should contact your doctor's office the very next morning. Don't delay until your next scheduled visit. Let them know clearly that you've experienced changes in your bowel habits and need to be evaluated soon. Phrasing it that way helps ensure it's taken seriously. Now, it's important to talk about the most dangerous type of stool you might encounter. If your stool ever appears black, deep black, resembling tar or used coffee grounds, you need to stop everything and treat it as an emergency. This kind of appearance often indicates bleeding somewhere within your digestive tract. As blood moves through your system, it darkens, which is why it shows up this way. Possible causes include ulcers, damaged blood vessels, or even cancer. What makes this especially concerning is that if there's enough bleeding to turn your stool black, you could already be losing a significant amount of blood, enough to put your life at risk. If you ever notice black, tar-like stool, seek immediate medical help. Call emergency services or go straight to the emergency room. Don't wait until the next day, and don't wait to see if it happens again. This situation should be treated with the same urgency as chest pain. There is one important exception to keep in mind. Certain medications, such as iron supplements or Pepto-Bismol, can also darken the color of your stool. However, stool affected by medication often appears more grayish or dull, while stool caused by bleeding tends to look shiny, sticky, and tar-like. If you're ever unsure, it's always better to be safe and get checked at a hospital. Another important warning sign you should never overlook is visible blood. If you notice bright red blood in your stool, on the toilet paper, or even in the water in the toilet, it's something that deserves your full attention. In some cases, this may be caused by hemorrhoids, which are usually not serious. However, in other situations, it could be linked to a polyp or even cancer. And the truth is, you cannot tell the difference just by looking at it. If you see a small amount of bright red blood just once, you should still contact your doctor within the next few days. But if it happens more than once, or if you notice a larger amount of blood, then you need to call your doctor the very same day. And if the bleeding is accompanied by symptoms like dizziness, weakness, or unusual fatigue, that becomes an emergency situation. In that case, you should go to the hospital immediately. Don't try to push through it or brush it off. Your body is clearly asking for help. Changes in your bowel movement routine are another key signal. If you experience constipation that lasts longer than 2 weeks, it's something that needs medical evaluation. On the other hand, if you're dealing with diarrhea that continues for more than 4 weeks, it could point to a more serious issue within your digestive system, such as an infection, inflammation, parasites, or even cancer. What many people don't realize is that everyday medications can also have a significant impact on bowel habits. Medications for blood pressure, pain relief, depression, as well as iron and calcium supplements can all lead to constipation. If you've recently started a new medication and then begin to notice changes like constipation, it's important to inform your doctor. In many cases, adjusting the medication can quickly resolve the issue. Never stop taking a prescribed medication on your own, but always speak up if you're experiencing side effects. Now, let's shift to something more empowering. I want to share 5 simple yet highly effective ways to protect your digestive health. These are the same recommendations often given to patients. The first is to keep your body moving every day. Long periods of sitting can slow down your intestines and make digestion less efficient. The good news is that you don't need intense workouts to see benefits. Even light, consistent movement can make a big difference. If you're able to walk, aim for about 10 to 20 minutes daily. This could be inside your home, around your yard, or even while walking through a shopping mall. If you use a cane or a walker, that's absolutely fine. The key is simply to stay as active as you can. And if walking isn't an option, there are still ways to get your body moving. You can sit in a chair and gently lift your legs, march in place, rotate your arms in circles, or slowly rock your body from side to side. These small movements can still help stimulate your intestines. The most effective time to do this is in the morning, especially after breakfast, when your digestive system is naturally more active and ready to function. The second powerful step is to cut back on junk food and start choosing foods that actually support and heal your gut. Highly processed items like chips,
Cookies, frozen meals, packaged snacks, hot dogs, and other processed meats can harm your digestive system over time. In fact, processed meats such as bacon, sausages, and deli slices have been scientifically linked to an increased risk of cancer. A lot of people believe that eating healthy is expensive, but that's a common misconception. There are many nutritious options that are very affordable. Bananas are low cost and widely available. Apples can be quite cheap when they're in season. Oatmeal is inexpensive and lasts a long time. Carrots are among the most budget-friendly vegetables. Canned beans are very cheap and packed with nutrients. Eggs provide a great source of protein at a low cost. Brown rice is affordable, and frozen vegetables are just as nutritious as fresh ones. You don't need fancy or organic products. You simply need real, whole foods that earlier generations would easily recognize. Here's a simple guideline to keep in mind. If a food comes in a box or bag and contains more than 5 ingredients you can't even pronounce, it's best to avoid it. A practical and budget-friendly meal plan could look like this. For breakfast, oatmeal with banana and a sprinkle of cinnamon, or eggs paired with cooked vegetables. For lunch, you might have a bean soup with carrots and onions, or a sandwich made with real chicken or turkey along with fresh vegetables. Dinner could be something like baked chicken with brown rice and frozen vegetables, or fish served with a baked potato and a side salad. For snacks, stick to simple options like fruit, carrots, or plain yogurt, and make water your main drink during meals. Eating this way often costs less than relying on processed foods, and your digestive system will work much more efficiently. The third step is something many people overlook: addressing parasites at least once a year. It's easy to assume this doesn't apply to you, but the reality is that millions of people have parasites without even realizing it. These organisms can steal nutrients from your body, leave you feeling tired, disrupt your bowel habits, and even contribute to more serious health issues. The good news is that treatment is usually simple, affordable, and often involves just 1 or 2 doses of medication. You can bring this up with your doctor during a routine checkup. If you have pets, this becomes even more important, since some parasites can be passed from animals to humans. The fourth step is to get a colonoscopy once you reach the age of 50 or earlier if you're experiencing symptoms. Many people feel uneasy about this test, especially the preparation beforehand, but it's one of the most effective tools for saving lives. Colon cancer often develops silently, without noticeable symptoms until it has progressed. A colonoscopy can detect cancer at an early stage or even remove precancerous polyps before they turn into something dangerous. Many health plans cover this screening, and in some cases, it may be available at little to no cost. If affordability is a concern, hospitals often have financial assistance programs. Don't let fear hold you back. Most people who have gone through it say the preparation is the hardest part, not the procedure itself. The fifth and arguably most important step is to care for your gut bacteria every single day. Inside your intestines live trillions of beneficial bacteria that play a crucial role in your health. They help break down food, protect you from disease, produce essential vitamins, and even influence your mood and energy levels. When these bacteria are balanced and thriving, your entire body benefits. But when they are disrupted by antibiotics, poor diet, or illness, your overall health can begin to decline. You can support these helpful bacteria by including foods rich in probiotics, such as plain yogurt with live cultures, along with prebiotic foods that nourish them. These include bananas, apples with the skin, oatmeal, onions, garlic, beans, and whole grains. The best part is that these foods are not only widely available, but also affordable and incredibly effective. Starting today, take a few seconds to observe your stool before you flush. It may feel unusual at first, but this simple habit can provide valuable insight into your health. You can even keep a small notebook and briefly note what you observe. Is it brown, soft, and easy to pass? This kind of information can be extremely helpful for your doctor if any changes occur. Make it a routine to check whether your bowel movements are consistent and comfortable. If they are, it's a good sign that your digestive system is on the right track. However, if you begin to notice warning signs such as black stool, repeated presence of blood, pencil-thin stool, long-term constipation, ongoing diarrhea, or any sudden change that lasts more than a week, it's important to take action and contact your doctor. Don't let embarrassment stop you. These are exactly the kinds of issues medical professionals are trained to handle. And if you ever feel like your concerns aren't being taken seriously when you call, clearly state that you are experiencing red flag symptoms and need to be seen sooner. The way you communicate this can make a real difference. Your body is constantly sending you messages through your bowel movements. The real question is whether you choose to pay attention or ignore those signals. Start paying attention now, because early action can truly save your life. The people who care about you need you, and you deserve to stay healthy. Listening to your body could make all the difference. Take this seriously. Every small step you take today can lead to a significant impact on your health in the future. This isn't just about avoiding illness, it's about preserving your energy, maintaining your vitality, and enjoying a better quality of life as you grow older. Your intestines are at the center of your overall health. When they function properly, everything else begins to improve. Your immune system becomes stronger, your energy levels increase, your mood becomes more stable, and your body is able to absorb nutrients more effectively.
Ignoring your stool is a lot like ignoring warning lights on your car's dashboard. The longer you delay, the more serious the issue can become, and in some cases, the damage may become much harder to fix or even irreversible. That's why it's so important to understand the subtle signals your body may be sending you. For example, stool that appears unusually pale, almost clay-colored, can suggest a lack of bile, which may point to problems with the liver or gallbladder. If your stool looks greasy, floats, and has a strong, unpleasant odor, it could be a sign that your body isn't properly absorbing nutrients. This is often linked to conditions like pancreatitis or celiac disease. On the other hand, if you notice mucus in your stool or it feels unusually sticky, it may indicate inflammation in the intestines, which can be associated with infections, inflammatory bowel conditions, or other digestive disorders. These are all early warning signals, your body's way of alerting you long before more serious complications develop. Paying attention at this stage can truly make a life-saving difference. Consistency is extremely important when you're monitoring your stool. If you decide to keep track, do it regularly. Write down the date, the appearance, the color, and how easy or difficult it was to pass. Over time, this creates a clear record that you can share with your doctor, making it much easier to detect patterns or abnormalities early. Think of it as a simple form of preventative care. It costs nothing and takes less than a minute each day. If you begin to notice even small or subtle changes, slightly harder stools, minor shifts in color, or occasional thinner segments, don't brush them off. Many people assume these are temporary or insignificant, but even small differences can be the earliest indicators of something more serious developing. Hydration is another major factor in maintaining healthy bowel movements. Drinking enough water helps keep your stools soft and easy to pass, reducing the risk of constipation and minimizing strain on your intestines. When you're dehydrated, stool can become harder, darker, and more difficult to pass, which can also hide other warning signs. Aim to drink at least 6 to 8 glasses of water each day, adjusting based on your activity level and the climate you live in. It's also wise to limit excessive caffeine and alcohol, as both can contribute to dehydration and worsen digestive issues. Fiber is just as essential. Soluble fiber, found in foods like oats, beans, apples, and carrots, helps your stool retain moisture, making it easier to pass. Insoluble fiber, found in whole grains, leafy vegetables, and nuts, adds bulk and keeps your digestive system moving efficiently. A proper balance of both types of fiber supports regular bowel habits and lowers the risk of blockages or irritation in the intestines. Unfortunately, many people don't get enough fiber in their daily diet. This can lead to ongoing constipation, straining, and increased pressure within the intestinal walls. Over time, this raises the risk of conditions like hemorrhoids, diverticulosis, and other digestive complications.
Probiotics and prebiotics play a vital role in maintaining a balanced and healthy gut environment. The beneficial bacteria in your digestive system help break down food, produce essential vitamins, and defend your body against harmful organisms. When this balance is disrupted, digestion can slow down, your immune system may weaken, and inflammation can increase. To support these helpful bacteria, include foods like plain yogurt, kefir, bananas, garlic, onions, and beans in your diet. At the same time, avoid unnecessary use of antibiotics, as they can disturb this delicate balance and leave your gut more vulnerable to infections and poor nutrient absorption. Physical activity, even if it's light, has a powerful impact on your digestive health. Movement helps stimulate the muscles in your intestines, allowing stool to pass through your system more efficiently. Simple activities such as a short 10-minute walk, gentle stretching, or even exercises done while seated can activate your digestive system, reduce sluggishness, and lower the risk of constipation-related problems. When you combine regular movement with mindful eating, proper hydration, and a fiber-rich diet, you create a well-rounded approach to keeping your digestive system functioning smoothly. Routine medical checkups and screenings are another essential part of prevention. Procedures like colonoscopies are not only used to detect cancer, they also allow doctors to find and remove polyps before they develop into something more serious. Depending on your symptoms, additional tests such as stool analysis, liver function tests, or imaging scans may also be recommended. Taking a proactive approach rather than waiting for symptoms to worsen greatly improves the chances of identifying serious conditions early when they are far easier to treat. It's also important to recognize the everyday habits that can damage your gut health. Diets high in processed foods, excessive sugar, and unhealthy fats can slow digestion, trigger inflammation, and disrupt the balance of your gut microbiome. Smoking harms the lining of your intestines, reduces blood circulation, and weakens your immune defenses. Chronic stress can also take a toll. It can alter how your digestive system functions, increase acid production, and contribute to issues like irritable bowel syndrome or worsen existing conditions. Choosing whole natural foods, practicing stress-reducing techniques like deep breathing or meditation, and eliminating harmful habits can significantly improve your digestive well-being. Now, let's bring everything together into simple, practical steps you can start right away. First, take a moment each day to observe and track your stool. Second, stay properly hydrated by maintaining a consistent intake of water. Third, focus on a fiber-rich diet that includes fruits, vegetables, legumes, and whole grains. Fourth, regularly include probiotic and prebiotic foods to nourish your gut bacteria. Fifth, make it a habit to move your body daily, even if it's just for 10 to 20 minutes. Sixth, schedule routine health screenings and never delay discussing unusual symptoms with your doctor. Seventh, cut back on processed foods, sugar, and harmful lifestyle habits while actively managing stress. By consistently following these steps, you build a strong foundation for prevention, protecting not only your digestive system, but also your overall health and long-term well-being.
The most important message I want to leave you with is this. Your body is always communicating. One of the clearest ways it does that is through your stool, yet it's something many people ignore simply because it feels uncomfortable or embarrassing to talk about. But when you take the time to observe, track, and understand these signals, you gain valuable knowledge that can help prevent serious illness, catch problems early, and put you back in control of your health. Don't dismiss these signs as unimportant. They are your body's early warning system, giving you advance notice that something may be wrong. Acting early can save lives, reduce suffering, and help you maintain a better quality of life for years ahead. The small habits you build, monitoring your bowel movements, staying hydrated, eating foods that support your gut, moving your body regularly, caring for your gut bacteria, and staying proactive with medical care add up over time. Together, they strengthen your digestive system and create a powerful line of defense against more serious conditions. As you begin to notice the benefits, more regular bowel movements, smoother digestion, increased energy, and even improvements in your mood, you'll start to see just how impactful these small, consistent changes can be. This is the true essence of preventative care, recognizing risks early and making practical choices to avoid serious health problems before they develop. Keep these critical warning signs in mind: black stool, repeated bright red blood, pencil-thin stool, constipation lasting longer than 2 weeks, diarrhea continuing for more than 4 weeks, or any sudden change that doesn't go away. These are not things to ignore. Take action immediately. Don't wait. Don't assume it will resolve on its own, and don't feel embarrassed. These are serious red flags that require medical attention. When you speak with your doctor, be clear and specific and share any records you've been keeping. This information can help them respond quickly, and that speed can make all the difference. As you begin to apply these habits in your own life, involve your family as well, especially children and grandchildren. Help them understand the importance of eating real, nourishing food, staying hydrated, being active, and caring for their gut health. By doing this, you're not only protecting yourself, but also creating a culture of awareness and wellness for the people you care about most. Early awareness and action can prevent unnecessary health issues, improve overall well-being, and even extend life expectancy. To sum it all up, your bowel movements are a daily conversation your body is trying to have with you. You have the ability to listen, understand, and respond by paying attention to changes in color, consistency, frequency, and pattern. By supporting your body with proper nutrition, regular movement, healthy gut bacteria, adequate hydration, and routine medical care, you give yourself the strongest possible chance to avoid serious illness and maintain long-term health. Don't wait for a crisis to force you into action. Start today. Make these habits part of your daily routine. Your health, your loved ones, and your future depend on it. Your body has been sending you signals all along. Now is the time to finally listen.